Well, good afternoon and welcome to Lunchtime Special Conversations. I am Pastor Cynthia G. West, and I'm going to be your host. Today's discussion: where are we now? A message to our community. But before we go into our discussions, I would like to remind all of those who have the primary in your area, in your city, or your town, we encourage you. Your vote is so important. And to those that also with the censors, we count. So we're asking you to please consider that as we go on. Also, I want to talk to you about the King's Pantry. The King's Pantry is a nonprofit organization within the city of Bridgeport. This pantry is a food pantry. It is open Monday through Friday from 10 to 1:30. We're asking you that if you need any supplements at all during this critical time, won't you please consider coming by the King's Pantry? Just bring an ID with you. We would love the opportunity to assist you in any way that we can. If during this session you want to ask the question, we're going to ask you to please place it in the comment box. And if you do so, we're going to read all that we're able to read during this time. Allow us this honor. Well, today is a magnificent day. We want to welcome our viewers from Norwalk and New Haven and Bridgeport around the state and the region to our lunchtime special. Thank you so much. Well, let's get started. We have some absolutely phenomenal ladies waiting to talk to us about this very critical and serious conversation. And let's introduce them. From Bridgeport, from New Haven, from Norwalk, from the surrounding areas, and even, again, the Bridgeport area. Let's go. Our Deanna Diamore, the Public Health Director of the City of Norwalk. How are you, Deanna?
I'm good. I'm so happy to be here today. Thank you so much for having me join you.
We are so happy to have you. We are so grateful. We're just going to pick your brains because you all know so much about this that we don't know. But before we do that, can you just tell us a little bit about yourself?
Sure. So I'm Deanna Diamore. I'm the health director for the city of Norwalk. I've been in my position for approximately 2.5 years now, but I started working in Norwalk in 2010. So I have over 10 years of experience working in local health departments. I'm really passionate about public health and just really serving the community and really working with the community to improve health. So thank you again for having me on.
Thank you for accepting in this busy time. Our next phenomenal guest is Cammie G., the Chief Medical Physicist.
Hello.
Cammie, how
Hello.
are you?
I'm wonderful. How are you?
We're doing well. We're doing well.
Awesome.
We are so excited to have you on this conversation.
I'm excited to be here.
Tell us a little bit about yourself.
So my name is Cammie G. I am a board-certified medical physicist boarded by the American Board of Radiology with a specialty in radiation science, specifically radiation oncology. I currently am the chief medical physicist at 2 locations in the New England region. I've been in that position for approximately 5 years now. I have experience of 10 years, well, more than 10 years, less than 30 years of experience in the field. And have traversed this country as well as the world.
Thank you. Thank you so much. We're looking forward to these conversations. Our next guest, Marissa Bond, the Public Health Director of the City of New Haven. How are you?
Well, thank you. Glad to be here. Thank you for the invitation.
Oh, it's wonderful having you. Could you tell us a little bit about yourself?
So sure. I am actually a native from New Haven, Connecticut, so I'm glad to be serving the city. Been in public health for the past 20 years, served as a director of health in a previous city, and actually the city of Bridgeport. And so just passionate about public health and also passionate about the Lord.
Oh, now you know I love that. So without a doubt, I am so excited to just be with you and to hear all of this information. Our next guest is Lisa Morrissey, the Director of Health and Human Services from the City of Bridgeport. How are you, Lisa?
I'm well. Thank you so much for having me today.
Oh, Lisa, we're so grateful that you have decided to come out of all of the busy times that we're having right now. Thank you for accepting the invitation. Thank you so very much.
Thank
All
you.
right. This is going to be so exciting. This is going to be so exciting. Now I'm told that our very special guest, is finally able to join us at this time. We want to welcome, with all appreciation, our Lieutenant Governor, Susan Bysiewicz of the state of Connecticut. Lieutenant Governor.
Hi, everybody. It's just such an honor to be here with these amazing and very distinguished women. I don't know how I got on this panel, but
Listen,
I am so happy to be here.
Not you, me. I'm the one. I'm still wondering, how did all of this happen? Isn't this amazing? It is so amazing. But
The
you
power
know,
of technology.
Yes. But Lieutenant Governor, you do a lot to support women and young girls in their causes. So here we are with some of your platform being distinguished. So we're very grateful. We know the time is short. So I want to speak to you, Lieutenant, if we can. Let's just get on with this conversation.
Sure, please.
Well, Dr. Fauci said that Connecticut is in a good place, and we're grateful to hear that. Because of the state's numbers, we are so low that we can use this favorable position to keep the numbers low. Since Isaias, another situation you all have had to deal with, this tropical storm.
We cannot catch a break. I don't know. A pandemic, a tropical storm.
When I say your hands are full, they are totally filled to the max. Filled to the max.
Shoulders.
All right. With this challenge of all of the thousands of neighbors that still don't have power and this ongoing cleanup, our community is still threatened, though, with this lurking coronavirus. Can you tell us how you and the governor are thinking of to keep our state in a good place?
So I think one thing that COVID-19 has laid bare is the inequities that we have in our healthcare system. And understanding that, the governor and I wanted to make sure that vulnerable populations, communities of color, and urban areas had access to testing that would be free. And we have been encouraging people who are frontline and essential workers to get tested, and anybody who has symptoms, isn't feeling well, has COVID symptoms, to get tested.
How are we doing with this? Are we making any progress at all?
So we are.
Great.
We have hundreds of labs in urban areas, and we have pop-up testing sites, and we've been working with faith leaders and community organizations to do pop-up testing in urban areas. And, you know, knock on wood, we still have one of the lowest infection rates in the country, and we are on track.
Okay.
Contain the virus. And the other thing that I would say is, but we got to be vigilant, because the governor and I just learned that there was an outbreak amongst young people in Bridgeport. So we really have to be vigilant, and we have to give a special reminder to young people to avoid gathering with large numbers of people and to wear masks, because that's so important to keep people safe.
All right. Lieutenant Governor, in the midst of all of this circumstances and situations, how can we encourage young people even the more of the value of wearing their mask?
So we need to ask young people to be role models, and we need to engage those who are influencers of young people from all walks of life to wear those masks and to model good behavior and keep social distancing protocols. And I know it's hard because all of us, regardless of age, are tired of this. But
Oh my God.
right? Exactly. Everybody wants to go back to normal. But if our young people, particularly the ones who are going to be starting high school shortly or going back to college, if you want to go back and stay, the best way to do that, the best way to stay with your friends is to wear masks and keep social distancing protocols.
I think we're going to have to answer the question that was asked by God, am I my brother's keepers? And in this, we certainly are one another's keepers. So it is so very valid. And to all of our young people that are listening, please cooperate. This is so very valid.
And
Well,
it's going to take a village, and it's going to take adults and parents who are seeing young people in the community who are not doing what they're supposed to be doing, and other young people to remind, and
yes.
leaders. Yes, indeed.
Do you remember in our younger years? We're still 24 and holding, but in our younger years, we had the whole neighborhood would monitor us coming in and out from school. They would monitor our conduct. And I think we need to go back to a little bit of that, because I think that we've been so free, and this is so confining, and it's so mentally challenging, but that we're able still to keep up with this. I believe that that's going to work.
And you know, I want to say this about Connecticut. I do think Connecticut is a village and a community like the one that you're talking about, because
Yes.
the governor and I, wouldn't have been successful in keeping our infection rates low if the residents of Connecticut didn't say, yes, we need to do that.
The
Yes,
support.
do that. And
And
right, exactly. So people listened and people modeled good behavior, and that's why we've been able to do so well, and we just got to keep it going.
I so agree. We agree with you. The World Health Organization has told us, according to them, there are a lot of inadequate information being passed on, causing there to be great confusion. Lieutenant Governor, what can we do concerning that?
Well, we just have to make sure that our message is out there and the facts are out there. And we actually have, at the state level, a COVID-19 site right on the front page of the State of Connecticut website. And you can get information from that website, anything you need about COVID-19. Also, 211 is a great resource, because for anybody in the community who's wondering where they can get tested or what's good, reliable, accurate information, 211 is fantastic.
Okay.
And the governor and I have been working very closely with United Way and 211, and we want to give them a shout out because they were both amazing.
Thank you so much. Well, we have these other phenomenal women that we've already introduced. Let's bring all of our conversationalists on. Just a ladies having lunch. That's all we're doing. Okay? There's so many questions we want to ask. So many. So let's get started. The first question I received is, can you get COVID-19 twice? Can we get it twice?
I think that's one for the doctor or the public health, but I think the answer is yes, right, ladies?
Yep. So I see the reluctance in everyone, so I'll take this one. So there was a lot of discussion and confusion about this. Early on we thought that you could not get it twice.
Okay.
Then it was distinguishing, did they really get it twice, or was the test picking up, the same infection twice? The most recent data and research that we have available to us does suggest that you can get COVID-19 twice, which is one of the reasons that we really do ask people that once you recover, that's not a time to become lax and taking precautions and protecting your health, because you can get it again. We want to make sure that people are being safe and taking it seriously.
Thank you so much. Is there a difference between the coronavirus disease and COVID-19?
Well, coronavirus covers a whole spectrum of viruses. And COVID-19 is a novel coronavirus. It is like none other we've ever seen before. So while they may have the same names, their causes are different. And so that distinguishes them. Also, COVID-19 is extremely transmissible from person to person, which takes it way beyond what we've seen in the past. So oftentimes you'll see on disinfectants in your home, it eliminates 99.9% of coronaviruses. And people think, oh, that's it. We're talking about something totally different now. This is the novel coronavirus.
Okay. I have to ask you, Cammie, as our medical physicist, if the coronavirus grows less from heat, and the warmer it is, the less it can stay on any item, how is it that the southern states are going so wild with their numbers?
That was a myth.
Mhm.
That heat was a myth. I won't say who perpetuated that myth, but that was a myth that has been proven incorrect. As looking at South America, looking at the coronavirus rampaging in Brazil, so Puerto Rico, as she said. So that was a complete myth. People were banking on it being like the flu. The flu doesn't necessarily disappear during the summer. It's just not something that's rampant throughout the community. And in taking that vein in it, that created the misconception that once it gets warm, we're home free. And we have been proven that is false.
Okay. What about expecting mothers? If a lady is expecting, what are her chances? Is she more susceptible, or is it just as if everyone else?
I don't believe she's more susceptible. I don't think any study has shown that.
Yep.
Okay.
But pregnant women are definitely at risk for getting infections, just like, anybody else,
Oh, okay.
like any other person.
All right.
But there is more research going into, are pregnant women more at risk for more serious complications? So that's ongoing.
Okay. All right. We just want to remind our viewers, if you have a question, tag us in that comment box and ask your question. All right. Something that is my personal question. John Hopkins, it's very disquieting. John Hopkins said there were 5 million. And yesterday, it was reported that even though John Hopkins said 5 million, it's more than probably 10 times that. How is that possible?
It's the number of averages, the people who are getting tested. So we're only testing a segment of the population. This country has 330 million people in it. So, but the CDC has said that we've tested people, we have 5 million positives. From that 5 million, we can make the jump to say that it is that. And other studies have shown that it can be upwards of 20 times that. And that's because we have other studies have shown that it could be possibly 20 times that, because as a nation, we have not contained the virus. As a state, we have done a great job, but as a nation.
Okay.
And what could I just add, since we're talking about these statistics, I saw a statistic that was stunning, and it was, right now we've had more than 150,000 deaths in our country from COVID-19.
Wow.
And had we 1 week earlier advised people to wear masks, and people followed that, 36,000 fewer people would have died. And, so that's back to your point about why should people of all ages, including young people, wear masks. That's the reason. That is just one simple thing you can do. Wear a mask. It saves lives.
And may I interject quickly?
Yes.
Because the lieutenant governor was talking about young people, and there was a uprising to this here in Bridgeport. I think one thing that young people have to understand is that while you may be asymptomatic and you don't have the severe complications of older people, that studies have shown when they are given CT exams that there has been damage done to the heart as well as to the lungs of those who are asymptomatic. And the understanding is we don't know how long those damages will hold, or whether it will be long-term damage. So as we enter into the flu season, you may end up in a conundrum where young people who would normally pass through the flu season easily because of damage to their heart and lungs may have difficulties from the flu.
Would you please explain that word that we just spoke of, asymptomatic? I think people get a little concerned and confused about the direct meaning of that word. Simplistically, not like a physicist, would you just tell us what could you just tell us what asymptomatic is?
How about I jump in there with it? The easy
Please.
public health definition. So
Come on.
asymptomatic means that you do not look sick, you don't feel sick, and anyone that sees you would not have any reason to think that you're sick.
Go
That's-
Lisa. Go Lisa. Oh, Lisa's tea.
And if I could jump in and ask our public health folks to comment on this, because this is what I find really amazing. How
Okay.
many, maybe they can tell us, the public health or physicians, how many asymptomatic people are out there who are infected and who could pass this along, because this is why it's so important to keep wearing the masks, but maybe one of our health professionals could tell us.
So there's a large number of individuals, and the actual number is unknown. One of the things that we discovered just doing testing, and when we supported testing at nursing homes, for example, and did point prevalence survey testing, where we had the majority of the individuals testing positive or that were asymptomatic, or when we did it in other sectors and proactively tested and people that were having no symptoms testing positive. And so it's so critical when we talk about individuals and promoting we say the 3 W's, wearing your mask and wearing it correctly, watching your distance and making sure that you're 6 feet apart or more from others. And number 3, washing your hands as frequently as possible, or carrying FDA approved hand sanitizers, because we also know there was such a rush for hand sanitizers to be developed. And now we're finding all these recalls with hand sanitizers that could be harmful.
Oh my goodness. You said 2 things we want to jump back in on. Wearing the mask correctly. What does that mean? Can you demonstrate? Does anyone have a mask?
I have my mask right here.
Good. Okay.
I was wearing mine earlier.
Okay.
I didn't go out of the house yet.
People are like this, okay?
Or like this. Here's another one. Not like this.
Or like this.
Oh,
This is just not the accurate way.
Oh.
Where
Or
is
what is
it?
happening
Here
like
he is.
this?
Oh,
At the
and here's what I
wristlet. They're
saw
wearing
over
it
the
as a
weekend.
wristlet now.
Okay.
I saw this one this weekend.
Oh, that's wonderful. That is so
This
effective.
is not correct either.
Oh my goodness. Okay. Marissa, would you please put on your mask correctly for our viewers?
Absolutely. There you go.
Okay. So as our viewers can recognize, it's right up under the eyes, basically, covering up under the chin without your mouth being out.
Or your nose.
Or your nose.
Okay.
Can I just add that, with transmission, people think about sneezing or coughing, but if you're speaking to someone, you're asymptomatic, you don't have a mask on, you can still transmit it to others. So it's really important why you need to.
When you say sneezing or coughing, I'm a person that suffers with allergies at times, and I am so concerned about coughing. I don't want anyone to think I'm coughing, because of it. So I'm constantly eating lozenges and moistening up my throat. It has made me so aware. But when you wear the shield, you all know the face shield that's out now. When you wear that face shield, do you also have to wear the mask over the nose and the mouth?
Absolutely.
Because I'm seeing a lot of
Added barrier.
people. Okay, I'm seeing a lot of people with nothing but the face shield on.
That's
not-
fair.
Okay.
It's not adequate protection.
Yep.
You need the face covering, the face mask.
Okay,
The face shield
viewers.
protects against from eye drop, from getting it from the eyes, but the masks are very important.
Okay.
And what I wanted to add,
Yes, go.
since we're having this discussion about mask wearing, the reason that the governor and I have not yet approved the opening of bars is because in bars you often will have lots of people packed in very tightly, and people go to bars to drink, and they would be taking off their masks. Also, bars tend to be very noisy, so people would be talking loudly, not wearing masks, and you risk transmission as you are talking to people in that environment. So, I know people are disappointed about that, but that is a very high risk situation.
Okay.
And as you can see in Florida, as well as in Arizona, Georgia,
Okay.
it was the bars that were really causing this surge. So to
Absolutely.
keep the bars closed is very wise, it's prudent, and it's something that, Connecticut residents have to appreciate what is being done in protecting us all.
And if
Yeah,
I
and
could,
the
if I
lieutenant-
could just add on that, to go back to Bridgeport, right? There was a situation where you have these sort of pop-up gatherings where lots of people show up, and if you're not wearing masks and keeping social distancing, this is a problem.
And what we saw here in Bridgeport was that we would have these young people attend these pop-up large gatherings, and we don't know who's at those gatherings that may be symptomatic. And then what would transpire was that they would go back home to their families and their parents, their grandparents, sometimes younger brothers and sisters, because we're talking multiple generational households. And then just like that, the virus jumps from one person. Now you're talking about the whole household could be impacted. So it's really important that our young people understand it's not just themselves that we're asking them to take care of. By wearing those masks and avoiding bars and those pop-up gatherings, you're protecting your family and your friends.
Yeah,
That's
and I
such a
think
great way.
I want to also add to that, the Lieutenant Governor brings up a really good, valuable point that we need to stress. We're
Okay.
now getting ready to reopen universities and colleges. I have 2 college students, disclaimer, and
We're
they-
24 and holding, no judgment zone.
you know what I mean? And they think, they're invisible. And we have restaurants that we've had to close because they have converted into these partying after hours, clubs and bars. And we want to emphasize the importance of, the social responsibility of business owners to making sure that they adhere to these reopening governor safety rules. And then also the college students, just making sure they take the proper precautions as they're traveling from all over the country into our cities. And so just making sure that they safely follow these health and safety protocols, because we are seeing an increase with younger populations
Okay, yeah.
testing positive.
Okay. And I think that we want to acknowledge to our young people, we recognize this has been a horrible time for you.
Yes.
Many of you couldn't go to your graduations. Many of you are not having a great beginning of college. A lot of you were limited. And it seems like everything is so confining and restricting.
Yeah.
And it really is. It really is. But it's not for anything personal other than your life.
And
So
safety.
if your life is personal, then it's for that. So young people, just please give us a shot and work to obey this. I have another question. How often should you be tested?
I think it depends. I think it depends on who you are and what you do.
Okay.
If if you work in a nursing home, you're going to be tested regularly. You're going to be tested on a weekly basis because you're around very vulnerable people. If you're a healthcare worker, you should be tested frequently. Same thing if you're around a lot of people in what you do. You're a first responder.
Yes.
Right, but I'd love to hear what our public health experts would suggest.
Absolutely. I agree. When people call our office and they ask, it really comes down to that. It comes down to, what's your occupation and who are you going to be around? Is anyone in your household a susceptible individual? Are you susceptible? And most importantly of all, having that conversation with your primary care provider, because you may have certain health conditions where your healthcare provider feels that it's warranted for you to get tested more often.
Mm-hmm.
Okay.
And as someone who works in the healthcare profession, I could say that, not in the state of Connecticut, but what I did find that we did have patients as well as colleagues that were positive, COVID positive. And the Department of Health, what the decision they made was everyone act like you have it.
Mm-hmm.
Okay.
The behavior, act like you have it. And so very early on in, probably mid-March, we were all under the protocol of act like you have it. And we started, everyone masked all day long. You can't enter in, only the patient can enter into the facility. Anyone else has to wait outside. You have to have your temperature checked. We can only have X amount of people within our facilities. So it was act like you have it. We're not going to test everyone, but if you assume you have it, we should be safe.
We do have another question. As we prepare to send our children back to school, should they be tested?
You want to
that's,
do it?
that's just such a debatable topic. Currently, the CDC is not recommending that children be tested. And so we utilize the CDC guidance as a vehicle for decision making. And so we can certainly explore that. But right now, that's not what the CDC is recommending for safely school reopening for guidances. So that's sort of the avenue that we're taking as we're meeting with our superintendent and making different, establishing different protocols. The same question comes up if whether or not teachers should be tested. And the reopening of that, and what does the teachers and administrators look like? And so it's certainly a debatable topic at this juncture.
Yeah, it really is, because I know a friend whose child went to daycare, and the child in daycare had it. And so now a little child, I think about 3, has to be quarantined to make sure they don't have it. So my concern was, and my question would be concerning these daycares, how do we, and I know there's no fail-proof way. I mean, this is also new. We have gone through so many changes since March, but is there any way that a parent could be a little bit more self-assured in sending their child to daycare, or is this just pray?
Can I just say this issue of daycare is huge, because we have, it is estimated that we've lost 45,000 daycare spots in our state because of the combination of COVID and the economic catastrophe that happened afterward, right?
Wow.
Because so many people, we've had more than 350,000 people lose their jobs in Connecticut, right? And when people lost their jobs or had to work from home, they took their kids out of daycare. And here's the barrier that this has created. We've lost so many daycare spots. It is now extremely difficult for parents who do want to go back to work to find daycare or to find that interim care for their kids after they're in school. And you're going to add this whole layer of the different online plus in-person learning.
Yes.
And I have to say that I have been working with Congresswoman DeLauro, who has had one package of $50 billion passed in Congress, but the Senate hasn't taken it up, to help with supporting daycare, because you had all these women, mainly women, who owned early child care centers and had to close them because they had no clients or too few clients.
Wow.
And it's a business that is, very much on the margin anyway. It's a tough business to keep and make money. I'm glad people are asking these questions, but I know that our Office of Early Child Care has a whole set of protocols for providers to use, and so if parents have an interest, our Office of Early Childhood can guide you about what kind of safety measures they should be taking. And for any women entrepreneurs out there who are sitting there saying, gee, I'd love to start a business, this daycare or early child care centers, there's going to be a huge need for them. So something to think about.
I also want to add that in the city of New Haven, what we did is we worked with our local daycare centers. And so once the Office of Early Childhood issued the guidance, there were a lot of questions because they have to work with local health officials in regards to contact tracing and things of that nature. So we conducted a series of webinars with our daycare providers and also offered support as they developed their protocols to provide guidance to ensure that it met the requirements. And so I have to say, in the city of New Haven, I'm very proud of the daycare facilities. They have done a phenomenal job on incorporating safety measures and protocols that include cohorting of their children to ensure that they can be able to track as well as employees. And so I commend the daycare workers that are and leaders that are out there working hard to provide childcare services to many of our parents that need to be in the workplace.
Okay. Can you also touch on the different types of testing, the nose, the mouth, the antibody?
Well, I got tested twice, and there was one, and I had the nasal cavity where they take what looks like an extremely long Q-tip and inserts that. The healthcare worker will insert that like very high up, and you think it's touching your brain. It's about 15 seconds. It is not a pretty sight. You don't want to take a picture. You don't want to have a selfie of yourself doing that.
No.
But I do think that it's important for you not to do the test yourself, because for a while they were letting people do their own swabs. And I think what we learned was it's safer if you have a medical professional who's trained how to do the test.
Yeah. And I think from the mouth to the nose, it's the amount of viral load that is present, and there's more viral load seen in the nose. And so that's what people are geared towards doing. In regards to the antibody test, that's a test to say whether or not you have had COVID-19. And at the moment, there is absolutely no antibody test there that is without issue. There are some that are giving, positives that are not positives. There are people who have been diagnosed with COVID-19, but once they take the antibody test, weeks later, it says that they have no antibodies, which by default says they didn't have COVID-19. So the antibody tests are filled with issues at the moment.
And so there's rapid testing. So there's rapid testing, PCR testing, and then the antibody testing that was just mentioned by Kimine. And the rapid testing is something that you can have the results the same day within 15 to 20 minutes. It's almost, and so that's also been, it has a margin of error rate because it's such a new test. And the PCR test has the most adequate results, and that typically takes 24 to 72 hours, depending
What
on
is
the
a
lab.
PCR test?
Yeah, it's laboratory testing. It's a laboratory testing for.
Is it still dealing with up your nose swab?
So yes, so it is still a nasal swab test. Both the rapid testing and the PCR testing. Currently, there is no approved saliva testing for any of the laboratories.
Oh, okay. Okay. Cam, I think this would probably go to you. The next question: are cancer patients at higher risk of severe complications from COVID-19? If so, please explain.
Well, it's not necessarily the cancer that's making you at a higher risk. It's the treatments that you're undergoing for that cancer that will make you at higher risk of complications once you do get COVID, if you should get COVID-19. So if you're undergoing chemotherapy, there's a high possibility or probability that should you get COVID-19, you would have way more severe complications than someone who is in perfect health and not receiving treatment for the disease. Within our clinic, patients who were newly diagnosed with cancer were given the option to delay treatment because they were going to undergo chemotherapy along with radiation therapy, delay treatment for several months. And then once the pandemic ended, we'd pull you back into treatment. Of course, the pandemic has continued on. And so hard decisions had to be made by those patients. And then there's also, we would give the option of hypofractionating, meaning we'd give you a higher dose per day, which means you'll get treated quicker and be done and back in your home.
Okay.
So it's not the cancer itself, it's the treatments that you will be receiving that will affect your immune system and therefore will cause you to be immunosuppressed, and which can lead to higher rate of complications.
Okay. Is it safe to get a flu shot in the fall?
Yes.
Yes, I think everyone should at this point.
Please go.
I think you all are all in agreement.
Yeah, because here's the thing.
The flu shot.
You got to get the flu shot because what you don't want to happen is get the flu and get COVID on top of that. That would be a public health disaster.
Yeah, I think
And I'd
that.
like to,
Go
oh,
ahead,
go,
Dion. I'm
Lily.
sorry.
I just wanted to add that many of us are looking at the ways we deliver the flu vaccine, and we're thinking about different models. So, in Norwalk right now, we're looking at a drive-through vaccination clinic so that people can either, have it within a location in Norwalk where people can walk to if they need to, or they can drive rather than having everyone congregate at the health department to get their flu vaccine. So, yes, get the flu shot. It's safe. It's effective. But also, as health departments, we're thinking about how we can make it even safer to deliver to protect the population, make it easy for them to get the flu vaccine this year.
Okay, another question. Can you discuss contact tracing? And if teachers receive COVID, will the entire class have to be quarantined? Let me read that again. Can you discuss contact tracing? And if teachers receive COVID, if they contacted or had COVID-19, will the entire class have to be quarantined?
I
So
can take that one. I'm sorry. Did I answer? Go ahead.
Go
I
ahead,
want to talk
and
over you.
I'll add after.
Okay, so contact tracing, it sounds a lot more complicated than it actually is. So when
Okay.
someone is diagnosed with a reportable illness, in this case COVID-19, we go back and then we want to find all of the people that they potentially came in contact with. It literally
Okay.
is that. And then we want to contact those people. It's completely confidential. We don't tell them who they came in contact with that has COVID-19, just that they may have been exposed to it, and there's some precautions that we would like them to take. And the information that they receive is really going to be based upon, what that level of exposure was. So it's a very complicated sounding term for something that by nature it's easy. It's a conversation that we have asking you to take additional precautions.
Okay. And Marissa?
No, she said it perfectly.
Oh, good. You passed, Lisa.
And I'll just add
Yes.
to your hypothetical. One of the things that we have said to school districts as they are planning for their reopening, especially for younger children, is
Okay.
to keep small cohorts. A cohort is a group. To keep kids together in small groups with their teacher, particularly in elementary school, with the idea that if you sort of limit the circle of contacts, you are able to limit the spread if someone should get sick. So you're not going to see in a lot of reopening plans kids going to eat lunch in huge cafeterias. You're going to see either kids eating lunch with their small cohort or going in a contained area with a very small number of people to have their lunch. Because the thought is if you keep people together in small groups, that's going to help reduce the risk of spread.
May I interject, please, in regards to contact tracing? There are two things that are important for contact tracing to be valid, and that is the level of transmission within the community has to be relatively low to make it a matter of being able to contact trace. And the second thing is that the results from testing has to come back in a timely manner in order to make contact tracing possible. Because if you're taking a test and it doesn't come back for a week or more, then contact tracing is a moot point. By that point, it's impossible to contact trace. That person has been out in society running into a number of people, and so it's impossible to contact trace. So there are two things. One, transmission level must be low, and two, results must be given in a timely manner.
And I think I would add a third point. Please, providers, complete the electronic laboratory report accurately, because sometimes we do not have accurate reports, so we have missing data, and that does not allow us to contact them.
I just want to add one other thing, that when you talk about what does close contact mean, that means you're within 6 feet of somebody for more than 15 minutes. That's what we use.
Wow.
Interesting.
Wow. Okay. Connecticut's communities of color, like Bridgeport, New Haven, and Norwalk, their rates seem much higher than white people. What do you say to that? And what is the message to our Black and Brown communities?
So I'll start, and then I'm sure everybody, my colleagues can, I think, can add. I think, for our city, what we have seen through community health needs assessment reports is that communities of color are disproportionately affected by pre-existing conditions and chronic conditions, and so we've already been put in a disadvantage. And so when the COVID-19 really hit this community, it really exacerbated their health. And so, we made a lot of effort within our city to really try to, number one, increase access to testing within communities of color, to not just make it about mobile testing, and do a lot of prevention messaging with community influencers, and also partnering with faith leaders to be able to assist us, because we know that messaging to different communities and early messaging is so critical to try to prevent. And we recommend that individuals, that have pre-existing conditions, to really try to take extra precautions, and should stay home, stay safe kind of messaging to try to reduce their risk.
And if I could just say that, just as Maritza is working in New Haven to address those inequities, the governor and I have been trying to do this at the state level. So making sure that we have information and adequate testing out in English and Spanish and other languages that are spoken in urban areas, and working with faith leaders, community health centers, and other organizations who can test people where they are in cities. And the other thing that we are doing to address this health inequity and inequities in other aspects, education, housing, the economy, is this. We have asked each mayor and first selectman across the state to put together a long-term recovery committee. And that long-term recovery committee is to focus on, it should be a diverse committee that represents all the different communities, communities of color, immigrant communities in your town or city. And the goal should be not to recover to where you were in March before the pandemic struck, but to recover from and work toward where you want to be in terms of healthcare, in terms of housing, and economic growth. And as a first task, we've asked the recovery committees to make sure that when someone does test positive, if they're in an urban area and they can't go back to their apartment where they have, elderly relatives or people that are immunocompromised living, that the city, and I think New Haven does this, Stamford does this, big cities will help you find somewhere else to stay, whether it's a hotel room or some other spot, so that you can recover and not risk spreading to your family, which is a higher risk in urban areas because people just don't have as much space.
Okay. Concerning the faith leaders, Lieutenant Governor, how are faith leaders from our government itself in Connecticut, how are they contacted? Because a lot of the faith leaders, they don't even know these things exist. It's just certain pastors who give them.
So if you have a master list of every faith leader, please let us know, because we will. I know the governor and I have had faith leaders involved with our administration from the very beginning. They were very much a part of our transition team.
I got you.
Right. And then after the transition, faith leaders were part of our Council on Women and Girls, which addresses 51% of our population. Faith leaders were also part of, I like to say women's issues or economic issues, right? But also faith leaders have been having conversations as part of the governor's Reopen Connecticut. And the governor was in very close conversation with faith leaders when he was trying to get their input as to how to open houses of faith in a healthful, socially distant way. So we love working with our faith leaders. Also, another way faith leaders have been involved in our administration has been through our Complete Count Census Committee.
Yes.
And I would ask faith leaders to seek out your mayor or first selectman and say, you would like to be part of your town or your city's long-term economic recovery committee.
Thank you. Yes.
Because those committees should have business leaders, labor leaders, healthcare leaders, nonprofit, faith leaders, immigrant communities, the NAACP, the Deltas, whatever trusted organizations are in your community, they should be part of that recovery process.
Great. Well, we have 2 buildings. I have a couple of buildings. We offer our buildings for any testing that's necessary. All right. So that's one you don't have to look for.
Oh, excellent. Okay.
Okay. As we go on, my questions concerning hand sanitizers. Is it as effective as soap and water in killing the coronavirus?
Nothing is as effective as washing your hands with soap and water. That's the best thing you can do. Hand sanitizers can be used, but really washing your hands with soap and water is the best thing you can be doing. And it's because you're really scrubbing your hands together. You're really getting the virus off. But hand sanitizer can be used when needed, but the best thing you could be doing is washing your hands for 20 seconds or more.
Okay, thank you.
And we want to say that the hand sanitizers needs to be 60% or more of alcohol.
I didn't know that.
Yeah.
Okay, 60% or more. Because when you go in, you just buy hand sanitizer and think that you have what is necessary. Thank you. Thank you so much. Can you explain the state's traveling list?
Okay, so this is something everybody should be thinking about. If they have relatives coming in from out of state, for example, or if you are considering going on vacation. So there is a list, and again, you should go to the state COVID-19 website and you can see the list. I think it's 30 states that are on the list because they have such high infection rates. So if you have somebody coming to visit with you from one of those hotspot states, you're going to want to make sure that they get tested right before they come and visit you. And what's going to happen if they get to the airport, they're going to have to fill out a form as to where they're going, and they're going to have to show that they've had a test. And if they don't, they're going to have to say that they're going to quarantine when they get here. So definitely take a look at that if you are expecting guests from other states. Or you can take a look because you may not want to go to a state like Texas or Florida or California.
I don't want to know.
Can I just add from a health perspective, just to add to what the Lieutenant Governor is saying, from a health perspective, we really recommend that if you're traveling and you're coming back, or you really quarantine for 14 days, because you can become sick, 2 to 14 days. The incubation period can be long. So you can go and get a test and you can come back and still develop symptoms later. So from a health perspective, we really try to, recommend the quarantine, and also just recommend really thinking about where you're going and not traveling unless it's absolutely necessary.
Okay, our time is almost up, but can UV light kill the coronavirus?
So I'll take this one. There are three types of UV light. It's A, B, and C. So the A and B are what we are familiar with because it causes tanning, basically, and skin damage, aging. It is UVC that is used as a decontaminant. And currently, within hospitals, we do use UVC as a decontaminant, but that takes place when the room has been cleared out. So the patient's gone, the workers are gone, and then the room is decontaminated. And depending on the strength, it will take time to have that room decontaminated. What we're seeing out there in the market, and the reason they do that is because the room has to be cleared because it can injure people, that UVC light. And we're seeing out on the market right now what I would call bootleg UVC. They're having people walking through these UVC lights.
I've seen that, yes.
And I'm laughing. And the reason I laugh is twofold. One, if you can see the light, it's not working. That's funny. Two is the fact that right now there are tests being run to see if there is a UVC light wavelength that can be done while a person is in the room, that we can decontaminate even while we're present. But then that adds the next issue that we have. COVID-19 is spread from the inside out. So while you may decontaminate my outside, once I walk by you and begin to talk, so it's really it's basically a false sense of security for people. One, if you're walking through something, they're telling you it's a UVC light decontaminant. I'm telling you it's not. It is not. Nothing has been approved on the market yet for that purpose, but you do see them being advertised. However, there are UVC lights that are used to decontaminate rooms. There are UVC lights that are used for HVAC systems to decontaminate air as it's being processed through. So it is, but there are none on the market that have been approved by the FDA to be used on humans.
Okay, thank you. Lieutenant Governor, this question has been given to you.
Okay.
With nursing homes facing closures, can you talk about support for the employees due to COVID-19?
Well, look, I'm not sure. There are public employees and there are private employees of nursing homes. So let me just say, those who work in nursing homes are heroes. You folks have done an incredible job in the face of terrible danger and risk to yourself and to your patients. So just let me say thank you. And our administration has asked that every staff worker in a nursing home be tested on a weekly basis, along with regular testing of the patients who are there. And there are requirements for appropriate staff levels so that the staff and the patients are safe. And during the midst of this crisis at the peak, we actually had National Guards people doing inspections along with our public health department. So and the other thing is we've engaged an independent investigator to look at what happened in nursing homes, and why infections were raging in some places. And amazingly, we had some nursing homes that had not one COVID case. And
wow.
Kudos to them. So we're going to learn what we can, and we're going to do everything that we can do to keep you all safe. Thank you.
Okay, to all of our panelists, can you explain what is meant by the vulnerable population?
I think the vulnerable population would, one, be definitely the homeless population, those who do not necessarily have the services that we take for granted, those who are currently working, who are considered upwardly mobile. The vulnerable population can also be and include those who are the working poor. They're the vulnerable population. It's those individuals who are most faced with the medical inequities that exist, as well as economic inequities that exist. And so I say the vulnerable population are what we call the essential workers, those who are working in your grocery stores. They're a part of the vulnerable population, because no matter how much they work, they're still considered the working poor. And so I believe that they are most definitely, that's what I would believe is a part of the definition of the vulnerable population, and include those who are the homeless, of course, the unseen. You know.
And I would also add immigrant communities who may feel, because we've had some mixed messages from the federal government, who don't feel comfortable coming forward to get tested because they can't lose their job. I would add the communities of color as well, especially in urban areas. I would add also vulnerable, the elderly, people in senior communities as well.
Thank you. Well, thank you all so much. Before we go off the air, Deanna, Cammie, Marissa, and Lisa, would you all like to say anything to our viewers before you leave?
I would. I got text to please request that those who have taken the COVID-19 test and have tested negative, that just means you're negative for that moment. It doesn't mean that now you can walk around fancy free without masks. Those who are purchasing masks, please don't purchase N95s. Leave those for the medical professionals who truly, truly need it. And yes, you are your brother's keeper. Please consider others before you consider yourself. If you feel that you're not going to be affected by COVID, then don't think of yourself. Think of others first and put on a mask.
I think for our City of New Haven residents, I just want to remind you that information is readily available for you at our City of New Haven COVID-19 page, as well as the Connecticut ct.gov website. Access to testing is critical. If you feel you're at risk and you want to be tested, our testing sites are also listed there. And remember, spread the facts, not the virus. Know the true information, and so that you know how to protect yourself and others.
And
Thank you.
I'd like to add that to all the great things everyone is saying is that there's a lot of we have our mental health is really important in all this as well, and there are a lot of great resources out there that our community partners are providing. So there's information on the Norwalk Health Department website, there's information on 211 in the state. So just remember our mental health well-being throughout this as well.
Yeah, I think that you ladies summed it up really. And I would add for Bridgeport residents to please visit our website. We do have community testing happening most days every single week. So please visit the website, find out more information about where you can get tested and when you're tested close to you. And make sure that if you are having any type of heightened, whether it's food insecurity, housing insecurity, please reach out to us so that we can connect you with the right resources and the right reasons to get you help. Thank you.
Thank you. Ladies, thank you so much.
Thank
Have a
you.
good afternoon.
Thank you. Stay safe.
Thank you.
Okay. So welcome. Great afternoon. Lieutenant Governor, thank you for your time out of this busy schedule that you do have with your hands both full, and we know that so well. But this has been a critical conversation that needed to be. Is there anything, Lieutenant Governor, that you would like to say to the people? Thank you. It has been a wonderful, wonderful discussion. It has been a very important discussion. Thank you. Thank you so much for listening. Please take the information. And we trust that we have been a benefit to you in giving you the information to all of our guests, the Lieutenant Governor, Deanna Amore, to Cammie G, to Marissa Bond, and to Lisa Morrissey, to all of those who have broken out of their schedule just to be with us. We give you our thanks, our high regard, and we say to our viewers, be safe, be true, and remember what you should be doing. Be blessed.